control in general is anything that can stop you from getting pregnant. And so there are different categories. The first category is called barrier contraceptives. And this is the
Hmm.
only contraceptive that can also prevent you from STDs, HIV, and STDs. So that is the female and the male condom. So we're much more familiar with the male condom. In fact, until I became an OBGYN, I never saw a female condom in my life. Now I have them in my office in case somebody wants to try them. So that gives you a lot more autonomy as a woman because a lot of the times, women don't necessarily have sexual freedom. You might not be able to tell your husband no. You might not be able to tell your partner no. You may be using sex as a bargaining tool. Like,
Hmm.
if I get to stay here, well, you can have sex with me for me to stay here. Or you might actually be a prostitute or sex worker, which you have to do it to live. And one of the things that has happened during this pandemic is actually there has been an increase in the number of sex workers, right?
Hmm.
Because people are having to live and they're losing their jobs and they're losing how their children can go to school. So they're trying to make money in different ways. I know in Nigeria we like to, make everything out to be really religious, but this is the reality of people's lives. Um,
Yeah.
so that's barrier contraceptives. There are some other things that you can use, like a spermicide to kill sperm. Spermicides, unfortunately, I don't recommend them because they can increase the risk of STD transmission. So
Hmm.
spermicides, there are films, there are diaphragms. Diaphragms have to be fitted by a professional, and that's kind of weird, right? Do you plan out your
Hmm.
sex? Are you going to be like, oh, I'm going to have sex on Tuesday, so Monday night I'm going to go get it fitted? So it's much more easier to use the male condom. I
Hmm.
always recommend, especially when I talk to young girls that are going to start sexual activity, I always recommend that you have your own condoms and you put them on, okay, in a way that you give space for the sperm to accumulate, and then you actually are the one that rolls it down because you know what kind of,
Hmm.
well, you are in charge of that, okay, unless you want to be pregnant or you want to have an STD. So
Exactly.
that's barrier contraceptives. I hope that makes sense so far. And
Yes.
then the next is family planning, like natural family planning. So, natural family planning is really useful for women who don't want to use, um, the barrier contraceptives. They're in a monogamous
Hmm.
relationship, which, that's neither here nor there because how many women really know if they're in a monogamous relationship? And so they're not,
Exactly.
worried about sex. And then the next, or sorry, STDs. And then the next is that they have regular cycles. So you can't do this if you
Hmm.
don't have regular cycles. So you're able to plot out your cycles and you'll know when you ovulate, right? Ovulation usually takes place 14 days if you have a regular 28-day cycle. So you can kind of plan out. Sperm lives 2 to 7 days in the canal, so you can kind of plan out when those are the unsafe times. And I have patients who tell me
Yeah.
they've done it for decades. When they want to have kids, they have kids. When they don't want to have kids, they don't have kids because they are able to plot it out. So
Hmm.
if you're gonna do that, there are a lot of apps now that can help you. My favorite app is one that I consult for. It is Flow app, FLO. It is the number one.
Oh my God, I use Flow.
Yes, I consult
I
for
use
them. So
Flow. It's
sometimes you might
amazing.
see an article that says reviewed by Dr. Arumala or written by Dr. Arumala. I see my little
Ooh,
mug up there.
amazing.
So Flow app is great for so many things, but for period tracking for contraceptives, it is a great place to be.
Yes.
So that's family planning. Then there's birth control, which are the pills. There are different kinds of pills. There are books this thick on pills. Hi, Seth. Seth used to be my workout partner. Sorry. I see people pop
Oh,
up and I'm
okay.
like, yay. So, so there's birth control. So whenever you think about contraceptives in GYN, in a woman's body, two of them stand out. We have more hormones, but two of them stand out. Estrogen and progesterone. Estrogen cannot be on its own, okay? We use it on its
Mhm.
own for menopause, but for birth control, it cannot be used on its own. Progesterone can be used on your own. Oh my God, if this I see somebody that has been on every single live I've been on. Thank you so much, Team DAP. But so with the combination, what you know, everybody normally knows as birth control is estrogen and progesterone combined oral contraceptives. When you hear birth control, that's what you hear about. Usually the different kinds, there are some that are all the same amount of hormone you get the entire time. That's called monophasic. And then there's triphasic, which is medicines that every week the amount of hormone that you get gets less. I suggest that the triphasics only be used for people who already have normal periods. If you have any abnormal bleeding, then you should not be using the monophasic, the triphasic, because it's going to mess up your system. Does that make sense? So you want to start off with, if you already have abnormal bleeding, you want to use the monophasic. Does that make sense? Then there's progesterone only. Progesterone only used to be one of those birth controls that are called the mini pill, is in that category. I only like to use the mini pill for people who have contraindications to estrogen. There are contraindications to estrogen, and that includes if you have migraines with aura. Estrogen can make you have more frequent, more severe migraines and increase the risk of you having mini strokes. So we don't give estrogen so if you have migraines and you're on an estrogen, go talk to your doctor and say you would rather use something else. If you have hypertension that is not well controlled, we don't use estrogen. If you are over 35 years old and you smoke, we don't use estrogen because that can increase the risk of blood clots in your legs and lungs. If you have liver disease, like hepatitis, or you have a liver tumor, we don't use estrogen. If you've ever had breast cancer or any cancer that is estrogen positive, we don't use estrogen. So there are many reasons not to use estrogen that we have to use progesterone only. And those medications, progesterone itself, like the mini pill, is not forgiving at all. You basically have to use it at the same time every day or you have breakthrough bleeding. So we use it mostly for women who are 21 days outside of delivering their baby and they want to make sure that they don't get pregnant. So that it's also kind of helping that they're breastfeeding, because that also prevents you from getting pregnant.
Yes.
So that's kind of helpful. When you're not breastfeeding, we start 6 weeks from pregnancy and we put you in the oral, you can do whatever you want. So that is the pills. So you can either have estrogen only or estrogen, progesterone, or progesterone only. In the progesterone only category, in 2018, a new kind of progesterone came out, and that's called drospirenone. And it also goes by the name Slynd. That I really like that. That one is not as finicky as the mini pill. So it gives you about 4 hours in between without you having breakthrough bleeding. And I use it more for my teenagers that have, or younger adults, because they have busy lives that also have a contraindication to estrogen. Does that make sense?
Yes, it does.
Okay. So then we have other contraceptives that are combined, estrogen and progesterone, that go in a ring or a patch. The patch itself, you can use it for a week straight and then take it off. Then you use it another week and then you take it off. Another week and then you take it off. Okay. And then the fourth week, you don't put anything on and you have your period. I should say that all combined contraceptives, you're not ovulating anymore. We are the ones that are controlling your periods by what you're taking, if that makes sense. Okay.
Yeah.
And then there's the ring. The ring is left in for 3 weeks and then taken out for 1 week. That happens to be my personal favorite of the non-invasive, because you don't have to think about it. It doesn't mean you don't have to be the one that controls it. It's in your body and it gives off what you need. So that's all the combined. Now, the progesterone only, you can get it as a injection that lasts 3 months. That's the Depo-Provera.
Okay.
You can get it as an implant in the arm that lasts 3 years. You can get it as an IUD that lasts anywhere from 3 to 6 years. Okay.
Oh, wow.
And then lastly, there's the copper only, which I think is very common in Nigeria, very common in Ghana. That's the Paragard that lasts 10 years. Any of the devices that you put in can be taken out at any time if you're having any side effects and or if you are wanting to get pregnant.
Okay.
So the most, and then obviously there's tying your tubes or the male getting a vasectomy. The one thing that I will say is that if you have a situation where you want to get pregnant in the next 3 years, there's one birth control I do not recommend. That birth control is Depo-Provera. Depo-Provera injection, you cannot take the hormone out. It's 150 milligrams of the hormone put into the body. There's nothing you can do. You can't just, I can't go into the
You
body
can't take
and
it out.
remove
You
it.
can't pause it.
Yes.
Yeah.
And there have been a lot of studies that show even 20% of women do not ovulate 18 months after after stopping
Stop
Depo.
it.
So that is the one thing that I don't recommend during that time period. I've had patients who automatically get pregnant, but that doesn't mean that the rule, because there's an exception to the rule, doesn't mean that the actual data is different.
Yes.
I do see a question. So somebody says, can a compatibility test be carried out to find the best with body type? I don't know what that means. So I think that your name might be Lola. Can you go ahead and ask that question again in a different way? I don't know the type of compatibility test, and I don't understand the type of body type you're discussing.
Okay, Lola, please ask your question again so Dr. Arumala can answer. Yeah. Okay, so while we're waiting for Lola's question, you mentioned something earlier, which I think one of the questions we got is related to it. And someone asked, beyond preventing pregnancy, what are the other benefits of birth control?
Okay, great. So birth control has a lot of benefits, even if you have a normal woman with no medical issues. One, combined birth control reduces the risk of breast cancer and ovarian cancer. Okay, that is just on basis. It can also basically help with bone health, especially that you give it estrogen. It can prevent acne. There are some people that will tell you that, what do you mean, Dr. Rumala? I started birth control and my acne went crazy. Well, that is that particular birth control with that particular person. I can put you on a different birth control and that can help you with your acne. There are different birth controls that can help you with your hair growth on your chin. If women get hair growth on their chin, particularly, so birth control, remember I told you, are a combination of estrogen and progesterone. Estrogen, what matters about estrogen is the dose of the estrogen. Progesterone, what matters is the generation of the progesterone. So there are 5 generations now. The 5th generation is the drospirenone that I talked to you about recently. Yeah. But the 4th generation also has drospirenone in it, and that is considered Yaz. That's what people have discussed before. And so that Yaz, ethinyl estradiol plus drospirenone together actually are almost as the same combination as having a medication that we use for hair growth called spironolactone. So that is is one of the most advantageous birth controls for hair growth.
Okay, great. Okay, another question here, and I think this question, it's a little, because in Nigeria we kind of, birth control is not something that is so popular. As a matter of fact, I was doing some research earlier and they said, I think it was from the UN, and it said that the contraceptive prevalence in Nigeria is about 13%. So only about 13% of women in Nigeria use contraceptive. So, I mean, and with a country whose population is exploding by the day, I mean, you would think that it would be a little bit more popular here. And I think it's the whole religious, cultural thing that we have going on. Like I have a question here. It says, is it safe for teenagers to use birth control methods? And which
Yes.
methods are safer for teenagers?
So I use all birth control for teenagers, all of them.
Hmm.
And so there have been some discussion about, first of all, like Depo-Provera. Depo-Provera,
Hmm.
you need estrogen in your to help your bones grow, right? You need estrogen for bone
Yeah.
strength. And so what
Hmm.
happens is that we end up giving Depo-Provera only has progesterone. It doesn't have estrogen. So there used to be a
Okay.
lot of debate as to whether teenagers should be able to use um, this Depo-Provera. And I actually find it most helpful in my teenagers. So what ends
Oh,
up
really?
happening is that we use it, but if they've been using it for up to 5 years, then we get a bone scan to make sure their bones are still
Hmm.
healthy. And if it's not, then we
Bone
take them
properly.
off because it's reversible. Um,
Okay.
Here's the thing. I am a Nigerian person, so I can talk about us dirty. Okay? There's
Hmm.
a lot of religion that masks a lot of interesting stuff.
Hmm.
You know, we talk about our culture, you know, because of my northern part. I have been to all parts of the north, from Kano to Zaria to, you know, I can talk about Benue States, Makodi, all
Hmm.
those places. And we have 14-year-olds who are married, right? We have 13-year-olds who are married. We have 11-year-olds that are married, married and having children. They're not, their body's not even done with puberty yet. And
Hmm.
so we have to not just come up with that sense, but come up with a situation where these girls, I have 12-year-olds in my office who are bleeding to the point where they need transfusions. We
Hmm.
need to be able to get to them and talk to and manage their periods. And
Exactly.
yes, we're using birth control. So I actually have more pushback from my Nigerian, my African mothers, and my Indian mothers than I do from anyone else
Wow.
because of the culture. And I have to discuss with them, this is not a license for your child to go out and become promiscuous because that's what they
Hmm.
really think.
That's their concern,
Yeah,
yes.
and you have to realize also, think about this. There are parts of the North where when you deliver, especially in Fulani culture, you literally have to get on the floor to deliver. Like,
Hmm.
you're not allowed to deliver in the bed culturally. So you get on the floor and you deliver and you have a laceration. Well, there's no doctor around to repair the laceration. These women are having fistulas, which is a abnormal passage from the rectum to the vagina, or from the urethra or the bladder to the vagina. So these women are peeing and pooping through their vagina starting at age 12, age 14. So these are things that we need to talk about. But I find it quite interesting because Nigeria has a dichotomy that's interesting. We have
Hmm.
a highly educated population, and we have a very illiterate population intermingling at the
Yes.
same time. And what is
Hmm.
different is that the highly educated population still lets culture and religion trump their education.
Hmm.
That makes it very difficult to deal with a lot of things. Um, I was working on being on a radio show in Sierra Leone this January, and everything I wanted to discuss was basically like, wait, what? We'll be talking about this on the radio? So that was, by the time I could negotiate, I had to come back to the US. But you have to realize that these things are, there's a lot of unnecessary problems in our culture that can be very
Yeah.
much prevented, right?
Hmm.
So I think somebody might have asked another question all the way
Yeah.
up.
Yeah. Someone says, is there a birth control that doesn't cause mood changes, depression, etc.?
Woo, that's a good question. I get that question almost every day. So
Hmm.
hormones control your mood in general. And so the only
Hmm.
birth controls that are not going to control your mood are going to be non-hormonal birth control, which
Okay.
include condoms, um, family planning, and copper IUD. They all have their own problems, but those are the ones. Now, I will say this. Most birth control are dose dependent and also depend on when it's initiated. And so for the first 3 months or 90 days, you can have all these problems and then it reverts to your normal state because your body got used to it. So most of the time, people don't allow that 90 days or 120 days for cycles. So I always tell, I tell my patients, call me if you want to get off your birth control because I'm going to talk you back into it till those 90 days. And then not every birth control is compatible with somebody. Like, for instance, my personal story, because I can tell my story. The birth control pills that I was on were not as useful for me as when I switched to NuvaRing. NuvaRing, I have the side effects I have. I like my breasts are bigger. Great, you know. Like,
okay, that's not a problem at all. Not a
so
problem.
I'm not complaining, but you know, like the breast tenderness it goes away. You know, I don't have breakthrough bleeding. I don't have, you know, those are things that are important to women. You want to be able to wear what you wear and not sit down, get up, and there's a big puddle of blood, right? You don't want that. Nobody wants that. So those are all things that we need to take into consideration. And I think that that's why you need a competent person, a gynecologist, going through and titrating the medicine for you. Because I can sit here and tell you about, if I start to name all the birth control, we'll be here till 2 more hours just naming the birth control. But I'm trying to figure out, what are your preferences? What can work with you? If it's not working, let's try something else. Right? Okay. Because I want people to have the benefits of birth control with the minimal side effects. Because it's possible. Yeah.
Okay, great. There's another question here in the comments. It says, what should a woman do if she continues bleeding after the use of birth control, injection to be precise?
Oh, so that's not for you. And you have
so maybe you should stop it.
So the first thing we need to find out is, do you have abnormal bleeding that has a structural cause? Do you have abnormal bleeding that has a non-structural cause? Like, do you have a polyp? Do you have fibroids? Do you have adenomyosis? Do you have cancer? We've got to find those things out. So abnormal bleeding with or without a birth control is not enough for me. I need to know what's going on in your life. So we have to investigate that. I don't believe in just treating bleeding. I believe in treating bleeding after we know what's causing it, or we know that all the arduous things or all the ominous things aren't causing the bleeding. Then there are people who, abnormal bleeding can be the one and only sign, or can be the first sign that shows that somebody has a problem with clotting their blood. So we've got to do all those tests. We have to make sure that, you don't have PCOS, right? Because PCOS causes you not to ovulate, and when you do ovulate, you have heavy bleeding. Or when you don't ovulate and it just accumulates and then the heavy bleeding comes out. So we have to make sure you don't have any of those things, right? So that's why I think it's a hard question to ask her. The first thing I would say is, if you had abnormal bleeding before the birth control, then we need to find out what the cause is. If you had normal bleeding and then you started that particular birth control, I'm assuming it's Depo, then that's not the right birth control for you. Because most of the time, Depo actually causes you not to bleed as opposed to bleed too heavily. So I would be concerned.
Okay, thank you for that, Dr. Ruth. Okay, there's another question here. Well, this one says, does birth control affect a woman's menstrual cycle? Also, do some birth control methods make women add weight?
Okay, beautiful questions. The first question is, heck yes. That's the reason why we're using birth control. Birth control is basically taking over your brain. So how do you normally menstruate? you normally menstruate by one part of your brain talking to another part of your brain, that part of your brain talking to your ovaries talking to the lining of your uterus, and then if you don't have a baby if you don't have a fertilized egg that cycle, then you bleed. That is a normal way it works. When we give you birth control, we take that all out. What's happening is instead of your ovaries making making the hormones, we're giving it to you by your mouth, by the patch, by the ring, by the injection, whatever. So now you're not ovulating because we have stopped it. So what it should do is, your brain is not a machine. Your brain is your brain. It is affected by stress. It is affected by mood. It is affected by nutrition. It is affected by a lot of things. So if I'm giving you something by mouth or like by medication, that turns that into a computerized, very logical thing. And so your period should get to be lighter instead of heavier, because now it is clockwork. If you're taking it clockwork, right? Because you could be not taking it. So a lot of times women come to me and like, oh, I'm bleeding through my periods. Okay, when are you taking your pill? I don't know. Well, I know that you're not taking it at the same exact time because you don't know when you take it. So then we tell them, you got to schedule it in at 7 p.m., 7 a.m., whatever, and they start taking it, they don't have a problem. So sometimes it's just about taking the pill or taking the medication at a clockwork. Some people forget to change their patch. Some people forget to change their ring. Well, the medication is done, so you're going to bleed. Now, in terms of weight gain, almost every birth control makes you gain some slight amount of weight, even though the studies don't show it anecdotally, every single person, except for the IUDs. The IUDs tend to be the one that gives you the least amount of weight gain. And I should say every hormonal. The worst is Depo. Let me explain why. Depo is a type of progesterone. So if you break down the word, pro, that's good. Gest is like gestation, that means pregnancy. So it puts you in a pregnancy state, right? What happens in the pregnancy state? Your appetite goes up, right? Progesterone works at the level of the brain to increase appetite. Now, I told you that almost every birth control has progesterone in it. But the difference is Depo is a large amount of progesterone injected into your body at once. 150 milligrams of Depo-Provera. So what you're going to end up doing is your appetite is going to be increased. It doesn't just add fat. You actually ate the food. So if you want to be on Depo-Provera, I tell my patients all the time, especially my young girls, eat the same amount of food that you are eating. You're not going to gain weight because it's an appetite stimulant. We actually give a type of progesterone called Megace to cancer patients to increase their appetite so that they gain weight.
Oh, okay.
So that is one of the thought processes. Now,
so doctor, what you're saying is if you can control your appetite, then you won't gain weight.
Yes. If you're eating because it's not just putting the weight on you now. It's a little bit different for estrogen and progesterone combined because that can cause you to have bloating. So you're not really gaining weight, it's water weight.
Okay, great. Thank you, doctor. There's another question here. Someone says, is it possible to switch from one birth control method to another? I've been on the injection and I want to switch to a different method. Is it possible to switch?
Yeah, very easily. We just let the 3 months go out. You go in. You should get a pregnancy test before any switching of any birth control, and then you can switch.
Oh, okay. Okay, great. Now this question I saved for last because I don't think this question will come up in any other country but Nigeria. But I think because of the reality of what unmarried women go through when trying to get birth control in Nigeria, I think that's why this question came up. And someone asked, are unmarried women who have not had any babies yet allowed to use birth control methods?
Of course.
If yes, what Well, people are asking this question because, I had a friend of mine had an experience where she went in to see the doctor to get birth control, and she was refused birth control in like a pretty popular hospital in Abuja, and she was refused. Basically, said, "Oh, you don't need it. You're not married. You've not had any children, so why do you need birth control?" And that is like, I think, a deterrent for a lot of single women that need these services, but they feel like if they go, they won't get the services. She had to go, my friend had to go to like a different clinic because this was like a family clinic where her dad goes, her mom goes, she's been going there since she was a child. And then this is her coming to say, "Oh, I'm 25 years old, I need birth control." And Dr. Legit said, "Why do you need it? You don't have a baby, you're not married." So, you know, it's back to the whole culture thing, back to the whole, religious thing that we have, where women are actually, it's a reality, women are actually denied birth control at some hospitals. So, I mean, the second part of the question says, if yes, what are the likely consequences in the long run?
Okay. First of all, my heart is hurt that that's happening. I've heard about it in like tangentially, but it's really sucks. And it makes me want to come practice medicine in Nigeria, even if it's for a short period of time, or like, in between working back and forth, because I
Yeah,
have colleagues that do that. So
yeah,
that's sad because
yeah.
unfortunately for women, I mean, it's so funny because, women get pregnant all the time and they're having to, you can't have it both ways. You can't make abortion illegal and also
Illegal.
make birth control illegal and still want to have, I don't know, I can get on
It,
this all day.
it,
Like, it just hurts
it
my
makes
heart.
no sense. Okay, so let me just tell you a little story. There's a clinic here in Nigeria. I think I would not mention their name. They do a lot of work in sexual health, in birth control, providing contraceptives and all of that. And one of the founders came on her Twitter account and she tweeted that they just started a program in a northern Nigerian state, and their reps are getting calls from the husbands of women saying, "You're the ones that are telling our wives not to give us sex. You're the ones teaching our wives, how to not give birth to children." And they're getting like calls. People are calling to say, "Stop doing what you're doing." People are calling to say, "Stop telling our wives, what to do," and all of that. It's the reality of what's going on.
Oh, I know, and it's really sad. It's really really sad, because that go boils down to the worth of a woman in Nigeria at today's age. Like, where's 2020 and we're still here. And the truth of the matter is, it's not big. It's not. Unfortunately, we can't blame men because I bet you half the people, or even more than half the people calling, are women, calling in and saying those kind of things. And there was somebody, she's an actress in Nigeria. She posted yesterday what did she say? It was something like how to be the reason for your own sexual abuse in Nigeria. And she wrote, "Be a woman, be Nigerian." I mean, it was like something like that. It's like really sad that
Yeah,
we're here,
yeah.
right? And that it made huge news that somebody is arrested for sexual assault, because that never happens. Um,
Hmm.
so we have a long way to go if we'll ever get there. I think the cultural, like, the patriarchy has basically, you know, we can get into that kind of conversation. But what I want to say about birth control is, birth control is for anybody trying to prevent birth. It's also used to prevent, yeah, it's also used for the management or the treatment of um, abnormal bleeding. There are women who've never
Hmm.
had sex. Never. I mean, I have 11-year-old, I have 9-year-olds, 10-year-olds who were hospitalized for heavy bleeding, needing blood transfusions. They have to be on birth control until their brain
Hmm.
kicks in, because what's happening
Hmm.
is their brain is too immature to manage
Hmm.
periods. So they're having anovular bleeding, which means bleeding without your body actually being in complete control. And
Hmm.
so obviously that works. There are some still thoughts. I think I said about there are some IUDs that tend to be a little bit bigger. And so for a woman who's never been pregnant, it might be too big to get in. And so we
Oh,
use smaller ones to manage. They have smaller ones like Skylar instead of Mirena. That's a small, I don't know if it's called a different name in Nigeria. But I can imagine that anyone who's doing family planning in Nigeria is probably a target for a lot of terrorist groups and religious groups alike.
yeah,
So
yeah.
because it's so unfortunate that in those same places are the same places that women are being raped, women are being conjugated, it's in those same, and then when the girl gets pregnant, it's only her fault. What happened to the guy?
Exactly.
The shame only happens to her. We're all having sex. That is part
I
of
mean,
life. People are having
yes.
sex. It is a natural thing to want to have procreate. Your body as a human being is made to want to reproduce. So if it's not the best time for you to reproduce, it is time for you to be on birth control. Now, somebody said this, and I want to read it out. Nigerian doctors suggest hormonal imbalance and potential infertility after birth control. That's why they tell you. That is a lie. It is a lie. There is absolutely no evidence for that. That is fear mongering. That is trying to control people with fear. That is trying to control. That is abhorrent that any doctor should say that. Any doctor that says that is not a competent doctor. You cannot. I'm very angry at that because, and this is how I talk when I'm filled with rage, you cannot tell people lies to control, to impart your moral values or whatever you think that is on other people. Period, point blank.
Exactly. Thank you so much for that, Dr. Rumala, and thank you for clearing that up. Just in case anybody that missed it earlier, the only birth control method that Dr. Ruth mentioned she would discourage for anyone, that's looking to get pregnant in the next 3 years is the injection. Am I right, doctor?
Yeah, the Depo-Provera injection. And that's just because it takes a while for you to ovulate. The second you stop taking birth, I have patients that have the implant, and I tell them all the time, do not walk out of my office without another birth control method or you will get pregnant. They're like, no. You know how many pandemic babies I have?
Oh my God, I can imagine.
Like, no,
oh my God.
Happen. No.
And they just go right out and they just go and get pregnant.
Because once it's no longer in your body, there's nothing preventing pregnancy. Nothing. So my dear beloved motherland, and always my place, who I am Nigerian, I'm Christian, I am Nigerian, that is who I am. We need to take care of women, period. We need to it is not your job as a doctor to dictate anybody's moral behavior. It's not your job. What your job is to do is to take care of women. Now, I should say this. I'm saying all that to say that I don't actually do abortions, right? That's a method of secondary family planning. I don't do abortions because of my religious beliefs, but I do not stop my patients from getting abortions. I support them if that's what they want to get, and I send them to someone who does abortions, right? So you cannot tell somebody how to, I don't get it.
I mean, it's the reality. And that's why conversations like this need to happen more often, so people know what is right and people are like sensitized on what the real thing is. But you can see doctors are telling women that, oh, if you use this, you might have a hormonal imbalance and all of that. But we need to realize that. And one of our guest doctors on one of our IG live sessions said, we need to be countercultural. Like, if culture is not moving in the direction of progress, then maybe it's time for it to evolve. So, I mean, we can't make abortions illegal and still deny women birth control. Like, it doesn't work. You have to provide,
Let me
one
tell
of
you
the
something.
two.
If men ever carried babies, we will have never had this conversation. This is not
Exactly.
a
I say
conversation we will
that
have.
exactly. Exactly. But that's a conversation for another day. I'm having so much fun with this conversation with you. I almost do not want to let you go, Dr. Ruth. It's been such an amazing chat with you. I've learned so much. So amazing. Thank you so much for your time, for giving us this little time with you. Thank you so very much. I don't know if you have any final comments before you leave us today.
So, final comments for me are twofold. Number one is find a doctor who understands you and who is progressive, especially if you're in Nigeria. Find
Hmm.
somebody who's going to work with you, that's not going to judge you, that's going to be real with you and allow you to get the medical care that you need. And my second thought is to doctors in Nigeria. Um, I consider myself a Nigerian doctor. I just happen to work in Texas. And my thought to you is read the literature and be real with your patients. Stop trying to control them because it is unnecessary to control people. You're either going to have, and one of the things that we always talk about is that family planning and all that, pregnancy has way more side effects. Pregnancy itself has more side effects than birth control.
Exactly.
Okay.
Exactly.
So.
Exactly. Thank you so much. Thank you so, so much, Dr. Ruth. This has been such an amazing session. And I mean, I feel like we need to have like another chat and just talk girl talk and,
Yes, we should do a girl talk
feminism in
Kiki.
Nigeria.
We don't need to
I
do
mean,
only medicine. I'm more than medicine, I
of course.
promise. I'm actually interested outside of medicine.
Oh my God. I mean, I saw your podcast. I went to your page, and right after this, I'm going to go on there and listen to because I feel like I'm connecting so much with the content I saw on your Instagram
Mm-hmm.
page. So I'm just going to go there. Everyone, please go and check out Pretty in Pink Pod by Dr. Aromala.
Yes.
It's just all things women. If you just want to talk about, she said she talks about faith, finance, she gives medical advice, just head on there and go and listen to a
So
couple
I
of
should actually
episodes. I
say
know I
this.
am going.
My podcast is not me talking. My
Okay.
podcast is a platform for other female experts. So if you're somebody that is an expert in something and you just send us a DM, my assistant will get back to you. I just facilitate the conversations. I am a hostess. I don't
Okay.
In the earlier ones I used to be the one that talked, but now I don't really
Talk.
talk. I just facilitate